Welcome to the ADURO Advantage series. My name is Michael Becker, and I am the Vice President of Global Sales and Partnerships at ADURO. During my 13 years in the industry, I've been able to see many dimensions and approaches to well-being. I've witnessed a dynamic, beautiful industry discover itself and progress toward optimization. Today, we will be redefining well-being, and we'll share with you how we are transforming the individual's experience and their organization's outcomes. For those of you who are not familiar with ADURO, we have been in the space for more than a decade. We have over 150 valued clients and over 1.5 million end users of our solution. We work hard to ensure the security, reliability, and success of each client, and their success has led to our acceleration as a high-growth, best place to work culture. We value our continued partnership, and we're excited to bring you this exclusive session at Lockton. Having worked with Lockton for many years, we value the partnership and the 13 shared clients in our book of business. We firmly believe that our strategies and tools to define and realize what is possible for individuals and their organizations to reach their goals through a coordinated, native experience aligns very well with Lockton's focus in looking beyond health to focus on a whole strategy versus just checking the wellness box. Through our shared customers, we have seen great successes. To highlight one, Busey, there's been a 9-fold increase in coaching engagement from 2017 to 2018. We attribute the success to our expanded depth and breadth of coaching paths, custom workshops with associates on-site, and a robust wellness champion network fostered by one of our coaches and mentors. Coaching participants have given 4.2 out of 5 in satisfaction rating with our programs and coaches. It's my pleasure now to introduce Dr. Darren White, ADURO's CEO. Darren is the inspiration behind the ADURO promise and the thought leader when it comes to how to unlock possibility in employees and their organizations, both of today and of tomorrow. A little later, we'll also hear from Renee Petrie, ADURO's Vice President of Healthcare and an industry icon in digital health.
Thank you so much for taking time out of your day for an update from the folks here at ADURO. We know there are many vendors you need to stay current on, so we'll keep this story brief and crisp. Let's start with a quick background. I began my career in well-being on the provider side. We had a small chain of wellness centers in the Puget Sound area, and what we learned very quickly was that the patient experience was a key driver towards better outcomes, far more than just the intervention itself. This aligned really well with the work we saw from Nobel Peace Prize winner Candace Pert, who made the breakthrough connection between our limbic system and our immune system. That connection plays a critical part in our ability to fight off disease. In other words, happier people have more white blood cells, a primary defense system in the body. We also learned that since people only interacted with the health system on an episodic basis, for example, only when they were sick, they were limiting their understanding of the daily behaviors that contributed either positively or negatively toward overall health. As we entered the corporate well-being space, we were shocked at the disconnected and alienating experience. It was right then we decided to build the most inclusive, connected experience by igniting the whole population to be the best they can be. We call this the Be Great at Anything experience. Simply put, changing anything in your life, whether it's your career or your health, requires behavior change. And we've been working on that behavior change model for over 25 years. Fast forward to today, as it turns out, we now have a massive ally, consumers. Well-being is a $4.2 trillion industry. We have whole categories and brands competing and differentiating with well-being. Everything from airlines, hotels, restaurants, to well-being as a tourism subsegment. We have consumers making buying and career decisions based on well-being, choosing to use their dollars to vote for sustainability and personal health. So naturally, we would find it quite amazing that there is no clear solution winner in corporate well-being, even after more than 30 years. With the explosion of technology and digital health, the innovation and traction is still less than stellar. We have zeroed in our focus on this topic and concluded that the industry is still very alienating, disconnected, and wrought with extrinsic rewards. At ADURO, we continue to double down on well-being. We entered this market on the promise of proactive well-being for everyone, and today there's so much opportunity to get this right. I'm excited to share that we have 3 critical factors as we think about winning in well-being. First, holistic, second, intrinsic, and thirdly, native. Holistic. This means the whole person and the whole population, not just those at risk. This inclusive approach meets people where they are with the things that are most important to them when the time is right. Intrinsic. We simply need to stop paying folks to jump through the corporate wellness compliance hoops. This is probably the toughest one, but exactly where most of the opportunity lies. Native. Coming from the provider side of things, this is the most exciting. What native means here is that the experience stays with one coordinated team working with you from one source of truth. Okay, so let's dig into each one. Whole person. We know this phrase is a bit overplayed, but if done right, it is certainly one of the keys to initiating long-term behavior change. We gain deep insights from analyzing 10 years of coaching calls to find out the exact paths where people took true change. You will notice we went broad in the sense of topics: health, finance, career, and purpose. But we also went vertical. For health, think health opportunities. And for fitness, think peak performance. For money, think budgeting. And for prosperity, think legacy, trusts, and estates. For growth, think personal growth, like goal setting. And for development, think career development with content around management and leadership. And for contribution, think how are we giving back versus sustainability, which is how are you preserving the environment. This inclusive approach truly drives engagement. Last year, we asked 44,000 users how motivated they were to change something in their life. 88% responded 8 or higher, that they were motivated to change something in their life. 52% answered their motivation to change something fell outside of the health category. Interestingly, when we compared that data with the actual health risks in an organization, we learned that more than half of those risks came from the population that is not focused on health. So why on earth would any organization focus exclusively on health and exclude these folks? Intrinsic. Our solution is focused on unlocking a person's intrinsic motivation. We may still need to jumpstart motivation with extrinsic rewards, but ultimately, ongoing engagement needs to come from an individual's desire to make changes in their own life. Each person is encouraged to focus on what matters to them, and then we nudge them towards areas we know they need to work on. Native. App fatigue is a real thing. We have so many apps competing for our time, and there is real anxiety about downloading yet another. Frankly, the lack of coordination between your health apps is scary. You may be working with a coach on diabetes and having another digital experience to tackle stress. Then at home you start a program preparing healthy meals and they all give you conflicting advice. When will there be an experience where the consumer and their relevant lifestyle and health data is at the center? At ADURO, we believe that time is now. We've built a native experience that coordinates resources and individuals and puts their interests front and center. We'd like to show you the ADURO experience. Now I'd like to pass it over to Renee Petrie, our Vice President of Healthcare, so she can walk you through how we support the individual to be great at anything.
Hi, I'm pleased to be here today. I'm excited to share with you a few of the innovations that we've been working on as we tackle the challenge of helping your clients and their employees be great at anything. Let me start with our measurement strategy. We think a lot about how we can use effective measurement as a strategy to deliver a more effective program that our clients and their employees really love. Of course, our annual well-being assessment and our on-site biometric screening events are core elements of our measurement strategy at ADURO. This year, we're enhancing our measurement capabilities in a few key areas. First, we're thinking about how we can leverage the key role that intrinsic motivation plays in ADURO's approach to well-being. And key to intrinsic motivation is aligning the user's experience with their own personal interests and needs. So, from the very first engagement, when our users log into our platform, we start by asking them what matters most. Across those broad areas of human performance, we ask them to just pick a few things that they're interested in and then prioritize what's most important. It literally just takes a minute, and what it does is it allows us to immediately begin personalizing the experience to the individual. Another area where we're innovating is the way we deliver our Well-Metrics on-site screening events. One of the key questions that we've actually heard from our consultant partners like you is, how frequently should a population be screened? So this year, the ADURO Well-Metrics program will offer a more personalized and evidence-based screening option. With our right time screenings, an individual's initial screening will be personalized based on their individual criteria, such as their age. And then after the initial screening, the ongoing annual monitoring will be based on the individual's needs and determined each year. This is going to enable us to create a more efficient, value-based approach for our clients and for their employees. We will continue our popular concierge service, which is unique to our on-site screening. And this is where people are given the opportunity, right after their screening, to learn more about their results, and our concierge staff can make the most of this teachable moment to support and guide individuals as they sign up for the appropriate programs and resources based on their individual human performance profile. Another key part of our measurement strategy is our passive data strategy. So this gives us the opportunity to better serve the people who use our programs by making it really easy for them to securely connect their personal devices into the ADURO experience. This year, we're expanding our passive data strategy with our Apple Health Kit and our Google Fit integration. So now, we can pull in even more data into the user's human performance profile. And this is going to give them additional insight into their health status, their activity progress, and this information will complement the other data sources within the ADURO experience. Further enhancing our measurement strategy, we're really excited to announce the release of our new Heartbeat technology. So Heartbeat is ADURO's proprietary survey technology. It's built for microsurveys and longitudinal data capture. And what this means is that we now have a fully integrated native tool that's going to allow us to pulse a population or group of individuals at any time and for any length of time. With Heartbeat, we've created the opportunity to move beyond the traditional once-a-year health risk assessment into more of an ongoing conversation with users throughout the year. And with Heartbeat, we believe that we will be able to better monitor the well-being of our clients' population on an ongoing basis, better measure our end-user satisfaction, and better measure the impact from engaging in different aspects of our program. And as an added benefit to our clients, we can also easily create and deploy surveys on behalf of our clients that are driven by their business needs and their priorities. The power of Heartbeat is enhanced with the introduction of ADURO's new communication platform, which is called Sparks. Our Sparks technology is designed to make it easier for our clients to communicate more effectively with their entire population or with a subset of users. Because we know that people are really unique, we've focused on building out a multi-channel communication platform. So this means we're leveraging things like mobile alerts, in-app notifications, text messaging, and email. And we're doing this because one of the biggest needs that we hear from our clients is the need to communicate more effectively with their population. With Sparks, we can help them more effectively deliver the right information to the right individuals at the right time to drive appropriate action. So this brings us to the advancements that we've made in our personalization engine. And this is all about tailoring the experience to the individual user. It is, of course, driven by and informed by our measurement strategy. So we're taking all of the active data, passive data, the third-party data that we've gathered to better understand the needs and interests of the individual. And then using this information, we can deliver the information to the individual with the right support and the right guidance, all in one unified native experience. The last area of innovation that I want to share with you is the work that ADURO has been doing around custom paths. One of the biggest problems with the wellness solutions today is that innovation seems to be limited to the vendor's unique point of view on well-being. And at ADURO, we've decided to take a different approach. So we've created the capability within our platform to deliver a more dynamic solution that can be used to deliver tailored content and experiences that leverage our clients' own proprietary content and their own existing resources. So for example, with our manufacturing clients, we know safety training is often a top priority. So now, in addition to leveraging our platform to engage in ADURO native experiences, we can also create and deliver custom paths around safety training. For our healthcare clients, we can create custom paths to complement the care they're providing to their employees, like the Be Well with Diabetes. So their employees can access and complete these client-specific programs within the same native, engaging, easy-to-use experience. One of the reasons that we've devoted the time and effort into creating these custom paths is because of a unique approach to innovation at ADURO that we call collaboration as innovation. This means that we devote a lot of time and a lot of energy working very closely with our clients to understand their well-being objectives and also to understand their overall needs at a business level. What this does is this allows us to enhance the value that we deliver to our clients by enhancing their ability to engage users more effectively around their well-being and around their key business initiatives. So, what does this look like? Well, let's take Roy. Roy is a 52-year-old assembly line worker. He's interested in moving into a supervisory position. He uses ADURO because it's easy and it's convenient. So whether he's at work or at home or on the go, the things that matter most to Roy are right there. Each month, he gets an alert to complete his safety training program, which is a priority for him in his position. He can complete that training program natively in the app, and at the end of the training program, he gets a heartbeat survey, which is built into the program to test for understanding. And as soon as he submits that heartbeat survey, he sees his points instantly accumulate in the app. When he's done with his safety program, he can step right back into his sleep mode program. Roy has decided to focus on sleep because it's important to him. He knows he needs his energy to perform well in his physically demanding position, and he wants to have energy left when he goes back home to his family and 2 teenage daughters. Roy loved the on-site resilience program that ADURO delivered last month, which prompted him to sign up for a one-on-one session with Coach Elise. She's supporting him with new techniques and mindfulness habits that he's built into his daily life to help him deal with his long hours and high-stress role. When Roy sees his human performance profile in his app, he's a little surprised and proud of how he started prioritizing his goals, the things that matter at work and at home, and his future possibility. The power of ADURO is meeting an individual where they are, both in the area of life that they want to focus on and in the way that they want to engage. ADURO will continue to innovate in the way that we deliver our programs, our guidance, and our support by offering self-guided content, asynchronous options, live and recorded webinars, one-on-one coaching, and on-site options. We do this so that we can offer an inclusive well-being approach that will fit into anyone's routine. So thank you for letting me take a few minutes to highlight some of our work at ADURO. I appreciate your interest in learning more about the ways ADURO is innovating to deliver a more meaningful and more impactful experience to your clients and their employees.
We know your time is valuable. We thank you for spending yours with us, learning more about the ADURO Advantage. We'd like to continue the conversation. There's another opportunity to dive deeper into how we're innovating with our healthcare clients, specifically with Mercy Health. Visit the URL in the chat window to register. We'd also love the chance to get together in person for a good old-fashioned lunch and learn. We will dive deeper into our product with your teams and answer specific questions about how we can support your clients to continue to innovate and move the needle in 2019 and beyond. Now we're ready for your questions. Please use the chat to ask any questions you have for us. All right, I think it's time to take some questions, and let's see what our first one is.
Darren, the question is, what are you doing differently to achieve better engagement with the population?
Okay, I'll take the first question. The first question was, what are we doing differently to achieve better engagement across our populations? Best answered in a couple ways. Number one is when we're talking about engagement in this context, I imagine we're probably talking about utilization. And first and foremost, we know that employees and individual users have rhythms throughout their year where they're concerned about finances at some point, maybe health at another point. Maybe it's about working with their manager or how to have a better one-on-one. Maybe there's family issues, and these things sort of go up and down during the year. And so our programming is designed to help meet those people in those needs at that time. And so we just simply have more opportunities for people to engage throughout the year. Secondly, we also use data to anticipate those inflection points throughout the course of the year. So we can nudge people when the time is right based on information we're getting from passive data or active data or how they've been communicating with us before to interrupt them in those kind of critical moments and give them programming. Lastly, I would say that when they're inside of a program or they're working with a coach, oftentimes that coach is looking at the entire human performance profile, and then they're able to recommend other or further steps. Now that they've captured a win in one category, we could go ahead and say, hey, we want you to do a win in this category, and it just kind of keeps going on. And then, of course, later on, as they run into something else, they begin to learn to think, oh, I have a resource for this, and I should jump back in there.
The next question is, Michael, what does ADURO do really well?
Great question. So the question that just came in was, what do you think ADURO is doing really well in market? And as of the three of us who spends the most time in the market, I get a chance to speak with a lot of clients and prospects. And I think number one, there are a lot of clients who have traditional wellness programs who are historically pretty narrow, and they're looking to create a more robust and a more comprehensive well-being program, but they're a little limited in their HR headcount and bandwidth. And so what we offer to them is the opportunity to create a very robust, comprehensive well-being and human performance program without adding a lot of vendor complexity. But we also work with other clients who certainly believe in the human performance philosophy, but they also have a lot of native and third-party vendors that they'd like to have utilized at the right time. And so our platform and programming allows for the surfacing and recommendation of other resources within the context of human performance, driving to more meaningful engagement in those resources as well. So I think those two areas, I think, are where I see ourselves, I see ADURO differentiating ourselves.
Next question, Renee. Do you do disease management?
Great. So the next question that just came in was around disease management and what ADURO does in this space. And we're actually doing some really interesting work in the area of condition management. We think there's really a massive opportunity here to really solve some of the biggest challenges in healthcare, which to a large extent just kind of come down to the way incentives are structured within the healthcare industry. And so for patients who are seeing a doctor, they have a 7 to 12-minute encounter with them. And when you think about things like the social determinants of health, we know that only 10 to 20% of outcomes are actually driven by that clinical encounter. The other 30 to 40% of those outcomes are driven by individual behaviors. And so we're working right now at ADURO on a new group of programs that are called our Living Well programs. And these programs are all about focusing in on coaching, which is recognized as one of the biggest things missing in the way care is delivered today. So that coaching is focused on those individual choices, empowering people to take a more active role in managing their own health, building the confidence to be engaged more fully in their own clinical decisions with their doctor, and of course adhering to their care plan, establishing care, going in for visits, taking medications. And so at the core, that's all about what ADURO does best, which is building those relationships with the participants that we serve and really focusing in on those individual choices and lifestyle that plays such a big role in condition management.
What about the future of on-site screenings?
Right, so a question came in about on-site screenings and what is the future of that. We've been doing on-site screenings for a little over a decade, and certainly in the last year or two, we've had some great internal debates with our chief medical officer about, what is the future of this? Where should we be going? Certainly our clients are starting to ask questions about, this concept of broad-based, annualized employee screening. Consultants have been pushing back as well. And so I think that, we had to come up with our kind of point of view here. What's interesting is should we actually be doing broad-based population-wide screening? Probably not. Not everybody needs a test every single year. And so what we've done is we've actually aligned our recommendations around the actual guidelines that dictate what we should actually be screened for based on your age, your gender, or your risk profile. And so we've taken that rules engine and applied it inside our technology so it'll allow our users to know which category they fall in. Some years they may just get a free pass and a high five. In some years they may be required to do some screenings, and inside of those screenings maybe it's only fewer or more depending on which category they fall into. So we do still believe that people should have some sort of touch point, whether it's a screening or a physician visit, because you can look good and you can feel good and have an underlying condition that's going along. And we know that if we can tackle that condition better, we have a better chance of beating it, and in some cases it's the only chance to beating it. So we don't want to move completely away from it. We just want to personalize this around the things that are most relevant for the individual, not totally for the whole population at once.
Oh, that's a great question. So the question was, who are we competing with most in the market? It's hard to keep up, frankly. There's a lot of consolidation in our space, a lot of companies buying each other up, trying to integrate technologies, trying to integrate workforces. And if I'm a risk-averse HR buyer, that's a little nerve-wracking. And so, frankly, it's hard to keep up. But what I will say of those companies, Virgin Pulse is who we see most often. And again, a lot of great companies in this space, a lot of them with very unique value props. Some are hyper-focused on the gamification of challenges and driving social engagement. Some are ultra-focused on disease management and mitigating risk. And I think where we do well against most of our competitors are when we work with clients who are interested in driving culture and driving intrinsically motivating programs and wanting to offer folks enough resources to be great at anything. And so those are the buyers that buy ADURO, but certainly a lot of great vendors in this space in their own right. I think we're about out of time, unfortunately. This has been really fun. So thank you so much for your time. There's a lot of vendors in this space, and you have a lot to do. And so thanks for spending your time with ADURO. We've had a great time. Wanted to let you know we do have a healthcare webinar coming up on December 4th. Renee is going to be running that. We're doing some amazing things with Mercy Health and others. Excited to tell you about it. And also our sales folks and our business development teams are out right now meeting with a lot of the offices, but we'd welcome an opportunity to host a lunch and learn and share a little bit more detail about all the great things we talked about today. So again, thank you for your time. We look forward to seeing you in the market and servicing your valued clients.